Doctors, what is the most disgusting thing you have ever seen? There is a few, I have experienced. 1. Anyone know what a diabetic foot is? People with diabetes often lose sensation in their feet from neuropathy and are prone to injury which ulcerates and can become infected once they don't feel the pain to tell them something is wrong. As a medical student I walked into a room and was immediately hit with the scent of rotting flesh. This person had a diabetic foot ulcer that had eroded down toddy bone and was just about the most foul thing I had ever smelled. 2. Patient wouldn't let me examine their feet. Attending comes in and takes the socks off without even thinking about it during the exam, and as the sock comes off, a cloud of dry flaking skin explodes into the air. As a student, I was able to nope out of their stat to avoid inhaling whatever that was. Looked like a combination of fungal infection with poor circulation causing the entire foot to be a scaly flaky mess. 3. Pap smear on an obese woman who clearly can no longer reach her hua to clean anymore. The was certainly a yeast infection as evidenced by the thick cottage cheese-like material filling her punani vault and clinging to the walls. But there was also a collection of thin mucus-like fluid pooling in the punani vault. And the smell? Just lovely. 4. Surgery module in medical school. I'm overnight with the surgical night team. Get a consult call to Ed that patient has a chest injury. The attending, the resident, and I go to Ed to see the patient. As we approach the curtained off area where this patient was waiting, the smell gets worse and worse. We enter the curtain and it smells like rotten flesh mixed with the foulest feces you can imagine. The guy has a gauze over a section of his chest. The attending lifts the gauze and we see a well-healed but open penetrating injury to the left chest wall. It seems he had been shot many years ago and the wound never healed and he never follow up with it afterwards. You could see his lungs and if you looked at the right angle a little bit of the heart beating. The attending 2-1 look at it and said, the rods I will never forget to this day, this is beyond the scope of my practice. And he walked out. I'm not sure what the next step was after that, probably CT surgery consult, but we were not taking on the case.